What are the best vitamins and supplements for hair loss?
When I do a full chart review of a patient, I do notice that patients are typically on a number of supplements. We have to really remember what the definition of a supplement is. A supplement is assistant. You need an assistant if you actually have a deficiency or if you're low normal. If your blood work shows that your vitamins and minerals are normal, that is because we typically get the majority of our vitamins and minerals from our diet. The biggest concerns that I see is that people take multiple supplements that actually have the same thing. For example, people will take a multivitamin and Nutrafol, which have a lot of the same things in them, and then they're also getting their vitamins and minerals from diets. So when I check their labs, we often see liver injury, but more commonly, we're actually seeing toxicity levels of certain vitamins and minerals. So we have to remember we first need to test, and if there is a true deficiency or there are certain labs that are low normal, that is when we can supplement. But we also have to remember that many supplements have different dosages. Once you start any supplement, you need to retest that lab work again 2 months later to make sure that the dosage is actually proper one, but it also may be a little too much. So getting blood work every time you make a move, whether it's adding or subtracting a supplement or adjusting the dosage, we need to get blood work 2 months later.